I'm going to talk to you about innovation in digital health in Parkinson's disease. This is actually a very huge field, and I only have 15 minutes, 14 and 59, 58 and so on. So I will try to give you an overview, especially where our group is working, so I can give you also some take-home messages showing you yes, some success stories, but also the limitation that we found and how to do the next step. So just a brief outline for the ones of you who know, but Parkinson's disease is characterized by several motor symptoms. Cardinal motor symptoms are tremor, slowness of movements or body kinesia, rigidity, and postural instability. The criteria, the clinical scales, assessments that are done in clinical practice are scales, for example, with numbers from 0 to 4 rating several symptoms, such as the UPDRS. There's pharmacological treatment. Levodopa is the standard treatment for Parkinson's disease, but over time it can lead to side effects such as dyskinesia, so involuntary movements, motor fluctuations, and involuntary contractions. There's an additional treatment for Parkinson's disease where when the side effects of the medication are no longer tolerable, there is deep brain stimulation, which is a neurosurgical procedure to provide electrical stimulation to specific parts of the brain. So now let's talk about digital health. So what are the innovation enablers in digital health? Well, there are a lot. I will focus my talk on wearables, mobile apps, a solution that encompass these, and data analysis, machine learning, AI, data science, how you want to call it. So we already had some, let's say, overview of wearable sensors. They can be embedded, they are lightweight, they can give you continuous real-time and pervasive monitoring of different physiological parameters. So, but what are the most common wearables used in Parkinson's disease? They are inertial measurement units. They are made to convert an inertial force, a movement, into measurable signals. So they can record acceleration, rotations, and also orientation. We all have our own inertial system in the vestibular system, besides smartphone, smartwatch, and all those kind of things. So when a patient moves, we can record acceleration, gyroscope, and identify all the informative characteristics of the signals of the patterns that we record, such as step, velocity, and so on. So I divided my talk in two main arguments: assessment and monitoring, and rehabilitation, assistance, and intervention. So about assessment and monitoring, as I was saying, scales and functional tests, standard functional tests, are used to assess the evolution of Parkinson's disease. They have some drawbacks. They are subjective. There are inter-rater differences. They do not capture all information, so they sometimes give summary or discrete level features. Usually the items are, for example, a scale from 0 to 4, and they do not show reliably what happens in the real world. So an example of innovation that is now in clinical practice at the Neurological Institute in Bellaria here in Bologna. So the idea was to take a test that is widely used in the clinic, the time up and go. So the person have to stand up from a chair, walk 3 meters, come back, and sit again. So the standard way of doing it is just taking a stopwatch and measuring the time. This is obviously a summary measure that gives you an overall performance of mobility. So the idea is to instead record the signal during this test, so that, for example, we are able to segment the test into its different parts in order to get features, information on the performance, of the functional performance in those different parts. This, for example, allows us to understand and evaluate what is the impact on mobility of the medication. So you can see Here on the left, people who were tested without medication, and on the right, people that were tested after the medication started its effect. So we can see the total duration, for example, taken automatically by this test, where the patient just has to wear a single sensor on the lower back, and the clinician must start a mobile app like we saw in the wearable session. We see that the total duration is different as expected, but we can also see some additional information. For example, the information about the turns. So we see here that the features, so the velocity of turning was different, also significantly different between in a state without medication and a state with medication. Not only that, we can also follow the concentration of the medication through blood sampling. So here we perform the tests every 15 minutes after providing the medications. We can think that after 75 minutes, the full effect of the medication is in. And we can see how we can monitor the pattern, the temporal pattern of functional mobility going in different concentrations of the medication. Another thing that is useful is that we can provide normative values. So of all the parameters, the features that we extract, we can provide normative values, in this case, in the off conditions, so without the effects of medication and with the effects of medication. These can be used also to perform early discrimination of people with Parkinson disease through a combination of the feature extracted from different parts of the system and the use of machine learning methods. But as a summary, why is it this system an innovation that is now used in clinical practice? Well, because it requires the same time as before to perform the test, which was a known test by the clinician. It's totally automatic. It can have a better integration with hospital records, and you can obtain a more specific evaluation. You can do the same thing evaluating standing balance analysis, always a single sensor on the lower back. The subject is just asked to stay 30 seconds still, and we can analyze the postural sway of the subjects just standing still. This can give us information. We can extract information from this signal. We can, for example, discriminate between the tremor that affects the signal of subjects of Parkinson's disease which exhibited tremor. We can also automatically identify the differences between Parkinsonian subjects who are mainly affected by postural instability gait disorders and patients who are of the tremor dominant subtype, so whose main symptom is tremor. The same postural sway that is given by the movement of the inertial measurement unit of the accelerometer can be used. Here is a study from Martina Mancini to see the difference between very early subjects with Parkinson's disease and age-matched control subject. So a first step to get to an early classification of Parkinson's disease when symptoms are still not so important. This is something that we can use in the clinical practice. But wearables, as we saw in other presentation, allow us an objective view of the functional performance also outside the typical clinical or laboratory environment. And this is where projects like Mobilise come in place. So having a wearable sensor also on the lower back that can allow a remote monitoring of 7 days, for example, can provide information with an increased time resolution. So I can do, the patient is followed more frequently than he would originally, and we can measure performance in the natural setting. In Mobilise, we will be able to process data from the clinical validation study on 600 subjects, and it will be possible to associate validated features, as Andrea Cereatti and Lynn showed you, extracted from the inertial sensor to predict, for example, for risk. And we have already preliminary evidence by Silvia Deldin that it could, for risk, can be predicted in Parkinson's disease. So the other topic is rehabilitation assistance support to intervention. So what I wanted to show you is a system, a wearable system that is for long-term remote walking rehabilitation. So rehabilitation is something that is a hot topic in Parkinson's disease. This is a totally automatic system made of 2 sensors on the shoes, one on the chest and an app on the smartphone developed by ML Technologies, which is a spin-off of the University of Bologna. In a study with the Neurological Institute of Bellaria and Tel Aviv Sourasky Medical Center, we tried this system for a long term. I think this is something very innovative, so using the wearable sensor for a very long term. So we tried to use it for 9 months in 20 Parkinson patients. The results were very good, so 17 out of 20 subjects actually trained for more than 3 months. They were told to perform gait training with this system, who could automatically evaluate gait, so evaluate walking while the person would walk, and provide a feedback to correct his performance, his motor performance. We found that also the system was well used or used with a good adherence with the people with Parkinson's disease of a certain stage and not with a more advanced stage. So I want to tell you a reason why it worked. So it's a modular system, okay? So it's 3 sensors, but you could also use 2. There's the personalization that is done by the clinician, and this helps also the adherence of the patient. It has a very easy interface, 1 single button in the app to do everything. There's a simplified report to the patient, and it is an adaptive intervention. Based on the fatigue of the patient, the system does not provide too much feedback. To improve for your study, your projects, and possible suggestions, always consider time to evaluate all possible technical and logistic problems. A first testing phase, even if the system is correctly working, is always needed. And check on patients during the trial, because some patients will not tell you that they have a very small problem with the system and they will stop using it. The other assistance device that we developed in collaboration with the KU Leuven and Tel Aviv Sourasky Medical Center is a system to identify motor block, freezing event in Parkinson's disease. So freezing events are motor blocks where the patient cannot resume walking. He is stuck. So the idea is to get the information from these wearable sensors and automatically identify these motor blocks that are characterized by a high frequency content. By characterizing this motor block with the 2 sensors on the shoes and a simple app, we can provide a metronome, a vocal feedback to help them overcome the block. And here you can see how it works. So the patient is walking, he's in tight spaces, so that's where freezing this motor block can usually occur. He does multiple steps and then the system kicks in. So the system automatically identifies freezing based on the signal from the wearable sensor on the shoes and help him with a rhythm to overcome the motor block. Very briefly, the use of the system improved fog severity, so improved the reduction of this motor block similar to the use of the medication. It was used a lot by the patients. As a take-home message, I would say that the system worked but could have been improved given the time constraints of the project. So ensure validation and pilot testing are always performed. And interestingly, we considered a step counter placebo app. So to understand what was the effect of our digital health innovation, we also provided to a control group a placebo digital intervention that would only provide them steps. This can be interesting to evaluate if some people are just technology enthusiastic and they would just improve because of that. Last thing, 10 seconds, as a peek in the future, wearable sensor can and will be used to support support interventions such as deep brain stimulation. So we can envision a future where since we need to set stimulation parameters such as amplitude and frequency of the stimulation and the combination with the medication, we can then add all the information from the wearable sensors to the clinical information that we already have to ensure that the evaluation of the clinician is correct and to improve the efficacy of the stimulator settings, reducing the time and effort required to do. In general, to support clinicians to take the right decision. Okay, thank you very much.